It's, depends on the parent too, again, because the difference between nurture love and acceptance love, and that's mom and dad. If it's a father trying to compensate for a mother, narcissistic mother, then the father has to do a bit more of the nurturing and making sure that the children feel heard, seen, and valued. If you're a parent and you're trying to offset a narcissistic parenting style, it's important to show your child positive regard. I say encourage your children based on their behaviors rather than the nature of who they are, but more on their behaviors. Wow, you really did that. I'm really proud of you. Keep going. You're doing a great job. Wow, I really like it when you behave this way. It really shows that you're growing and you're maturing, and and really just focus on encouraging children for their behaviors. Of course, you're my son, you're my daughter. I love you. There's nothing more valuable to me than you. But at the same time, you want to make sure that you're constantly giving them some good emotional feedback on who they are and their behaviors. And so that will encourage them to be better and healthier children, right? And they'll eventually grow up with these positive behaviors. It doesn't do any good, and it's not helpful to badmouth the other parent, because that can create parent alienation. I do have problems with parents badmouthing each other, especially mothers badmouthing fathers, because ultimately children, both boys and girls, need dads. They don't realize they're doing some severe harm to the psyche of the children, and eventually those children will grow up and have problems, either trusting men or being a man, and that's part of parent alienation. So, a BPD parent will have a tendency to, if the other parent isn't in line with the praise and worship and adoration of how wonderful they are, isn't in line with that, will have a tendency to lash out at that parent, and then and that creates a lot of problems in the children's psyche, because they see that, and so it impacts them as they develop into young adulthood, right? So I think that positive regard, affirming them for who they are, affirming them for their good behavior, that's a good way to feed their identity needs.
You had touched on it about not saying anything about the other parent. What should a parent do? Should they identify the behaviors for their kids? Should they just not say anything? What?
Well, age is important, and the younger they are, the less likely it's a good idea to talk to them about their mother or father.
Right.
So I don't encourage that. I think that can create parent alienation. I think that children eventually, as they get older, start to understand, mom and dad, and understand the dynamic that's happening. It's still not a good idea to label a parent the opposite parent. And so what I would encourage is therapy for kids is really important. I think that's a valid way of helping a child cope, so that kids can, actually speak up for themselves, assert themselves, and not have their identity diffused. So the parent that doesn't have the personality disorder can offset a lot of the behaviors of that parent by making sure that they're affirming their kids in the way that maybe mom or dad, whoever has the personality disorder, is not doing. Because one parent, at least grounded parent, who says, okay, I see you, I have I'm validating your feelings, I see you, I value you, is going to be better than no parent, right?
Right.
And
being their safe space.
Right, exactly. And so, and then I think that's where mom and dad have to have it out a bit, okay, and say, you can't do that, you can't say that to our child, that's not healthy. These are baked in traits of personality, so there isn't going to be a lot of therapy around, especially NPDs. BPDs seek therapy, and NPDs avoid therapy. So, when you're a grandiose narcissist, you don't think that you need therapy. It's everybody else's problem, right? When a parent has BPD, which is usually characterized by abandonment, fear of abandonment, and unstable relationships, they usually seek out therapy because they're not happy about it. But nevertheless, the other parent has to establish with that parent, hey, we can't do these things. We have to set boundaries. So I always talk about behavioral changes for both, because I think at least with the NPD parent, there can be some behavioral modification and conditions and boundaries set with an NPD parent, right? But that's a big burden on the other parent, because the other parent has to make sure that the child is understanding that some behaviors are unhealthy,
right,
even without labeling it and even without, bad mouthing the other parent.